The complete release of both anterior and anterior-inferior joint capsules was performed, followed by refreshing of the glenoid medial wall and bone bed. A double suture anchor was precisely inserted adjacent to the 5 o'clock position. The first of the two sutures was strategically used for repairing the inferior and anterior-inferior capsular tissues in an inferior to superior direction, while the second suture was intentionally preserved for subsequent reconstruction steps. A single suture anchor was arthroscopically positioned 5 to 8 mm below the cartilaginous surface of the medial wall of the glenoid, near the 4 o'clock position. To facilitate graft delivery, a 10 ml syringe was modified by creating an oblique 45 degrees bevel at its tip, which served as a customized cannula to expand the anterior portal. Following the in vitro passage of the suture from the 4 o'clock anchor through the pre-drilled hole for bone block positioning, the bone block was accurately delivered using the modified syringe. Secure fixation was achieved with at least one SMC sliding knot, followed by selective suture trimming. The preserved suture from the 5 o'clock anchor was threaded through the pre-drilled hole distal to the bone block using an Ethibond traction wire shuttle technique. Specifically, the suture was passed through the Ethibond traction wire already positioned in the pre-drilled hole and then pulled to ensure proper passage. This suture was securely tied at the 5 o'clock anchor hole using a SMC knotting method to stabilize the distal portion of the bone block and subsequently used for closure of the anterior-inferior labrum capsule complex. One suture of the 5 o'clock anchor was firmly knotted and trimmed under arthroscopic guidance. Subsequently, a double suture anchor was placed adjacent to the 2:30 o'clock position. One suture of the 2:30 o'clock anchor was threaded through the pre-drilled hole proximally to the bone block using the same Ethibond traction wire shuttle technique. This suture was securely tied at the 2:30 o'clock anchor hole using a SMC knotting method to stabilize the proximal portion of the bone block. Thus, triangular stable fixation of the bone block was achieved, providing 3-point biomechanical stability. The other suture of the 5 o'clock anchor was firmly knotted and trimmed under arthroscopic guidance. A single suture anchor was placed adjacent to the 3 o'clock position. The suture of the 3 o'clock anchor was used for comprehensive repair of the Bankart complex. Both sutures from 2:30 o'clock anchor were utilized for labral elevation and capsular tensioning. The repair of Bankart complex and the fixation of bone block were meticulously evaluated.